I'm Laura Ann. I'm a clinical therapist at Cook Children's. I've been at Cook for 5 years. I'm currently in the gastroenterology department, and I have been working with my facility dog, Neely, for a couple years as well. I work with a lot of kiddos with chronic diagnoses, and then also kiddos that have really bad stress that can cause a lot of physical symptoms in the body. I've always been super passionate about that and love being able to educate people and kind of figure out how we can get past those hurdles. So, anxiety can manifest different ways with kiddos. I think a very popular way that we're seeing these days is a lot of like the fidgeting, the moving around. It almost kind of looks like ADHD symptoms, struggling to pay attention. But I think some things that we don't necessarily realize is that we see anger outburst. Anxiety can definitely manifest in a lot of kind of anger, irritability, quick temper. So we see a lot of those symptoms. We also have a lot of physical symptoms as well. So we see a lot of stomach aches. That could be nausea, vomiting, diarrhea. It could also be vertigo, headaches. So we're seeing a lot of kind of different symptoms that anxiety can present. So, figuring out different ways to see if your kiddo's symptoms are anxiety based versus if they are more physical in nature, so natural headaches, things like that. It's really important that you start tracking that information, figuring out when are these kind of headaches or symptoms happening? Are they recurring at the same times? I always think it's a great idea to get, a general checkup by your doctor to make sure that we can rule out any viruses, things like that. But really kind of honing in on what might be triggers and what might be going on, kind of big picture with that kiddo that might cause these symptoms. So a lot of times parents want to know what can they do to help their kiddo that has anxiety, whether it be physical symptoms or not. I think really talking to them about their worries or concerns is the first great step. Normalizing it. It's okay to have worries. It's okay to have stress. We all have that. And then also talking to them about like what are ways that they cope with their stress and anxiety, right? Us as parents, we have to talk about kind of how we handle our stress, and modeling that behavior can be a really great technique for your kiddo to see that and be able to start implementing that as well. I think it's really important to work with the school on figuring out a good plan for each kiddo, whether it be working with the school counselor, the teacher. If we're having pretty significant stress and anxiety every single day and it's not seeming to improve with just communicating, talking about it, implementing coping skills, I think that that could be a really great time to start reaching out to your healthcare, mental health professionals to see kind of what is the next best option for your kiddo.